So when somebody's thinking about making an investment like this, what are the options of paying for this, and how much does something like this cost?
You know, I'm trying to remind patients that most people that are getting this procedure are using some form of financing.
Okay.
And so we really try to make a lot of options available. And it's very similar to somebody wanting to buy a car or something like that in their life. And so this is not typically something somebody is paying cash for.
Is it something they have to go find the financing, or is that something they can do in-house with you guys?
We have multiple financing options here, and we try to make that very accessible for people, because it's another added step to have to go outside of our practice and try and find the money to do this.
Right. So easy, all in-house. You come in, you get the consultation, you figure out what is available to you and what kind of a candidate you are.
Yes.
Right? And you have all the financing options available. And this is a life-changing procedure. This is not a quick fix and you're going to be back in 5 years. This is for life. And so you're making an investment not only in your smile, but in the rest of your life, which is
absolutely
fantastic. And all in one place makes it so simple. So one of the things I'm curious about, so you come in for your first appointment and you have your consultation, you schedule the first surgery, and same day or next day, you walk out with a new smile. But there is a recovery time that is soft foods. What happens next?
So the final step really of this process is to get your final teeth. So the temporary teeth, I call them your smile teeth. These are the teeth that you're on a soft food diet and you're being as gentle as you can with, but they're a full smile tooth or set of teeth. The final teeth are made out of zirconia. So zirconia is a beautiful ceramic. It looks very natural. It looks like the teeth it looks better than the teeth you probably had earlier in your life. Wow. So the zirconia gets milled in office. So again, everything is done here. At the final 2 appointments, we have you in and we get you in the chair and we take final impressions for the zirconia teeth. In that appointment, we're not numbing patients. You're not asleep. It's not a surgical procedure. It's a very quick procedure. Wow. Once we get the records that we need, we're able to make your next set of teeth, and then all we have to do is screw those into place.
Wow, that's incredible. So tell me, when somebody walks out with their forever smile, are they? Do they look all shiny and bright and like a movie star smile, or do they look natural, like this was the smile I was born with? We
use a lot of special records to make sure that we're giving the laboratory as much information as possible, and that allows us to make a very natural smile. Of course, we can give you a Hollywood smile if you want it, but we like when our patients have a very natural smile, and that way, when they're with their families and they're communicating with people, it's not an eyesore. We want it to be something that fits into their profile very well.
Oh, I love that. Tell me, when someone is considering this, what would you say directly to them? Like, what is that message that you would want them to know?
So I would probably say that I just would love a chance to meet you and talk to you about the options that you have. Nothing more than that.
Dr. Shawn, thank you so much for all this information. If I had a family member, I would feel so safe and secure bringing them to you to talk through what this might be.
Well, thank you as well. It's such an opportunity for me to come and talk to people about this procedure. I think it's really life-changing for people.
It's a beautiful thing you're doing.
Yeah.